Can you share anything about your success rates?
I can tell that high percentages of success rate, it depends on the situation. So if it's donation surrogacy, then it's different success rate is like 70-80% has to be successful. If it's patient, it depends on maternal age, what is the age of the woman, and also sperm quality. So it's in general, we have high success rate and we're happy with this.
And do patients have any other concerns before commencing treatment?
Yes, they want to know in details what they have to go through, how long they have to stay in our country, and what investigations they have to go through at our clinic. So we can provide all informations in details with them.
Why do patients from the UK choose Georgia for treatment?
Most of the patients, they think that the treatment in Georgia is more affordable for them. Also, most patients, they ask about donation and surrogacy cycles, packages. So this donation, we have a lot of variety of donor profiles, and also we have a great choice of surrogate mothers. So that's why they discuss to have treatment in Georgia.
Which treatments do patients from the UK usually come to you for?
They come for if they have many unsuccessful cycles in their own country and they want to sort it out what is happening, and they want some additional investigations, like they want PGTA testing, or they have some problems with anti-Mullerian hormone, and sometimes they need to donor oocytes. Also, if patient has recurrent implantation failure, has adhesions in uterus and some uterine factor infertility, also severe male factor infertility, they ask for some additional tests like IMSI, PICSI, and so on. And we can provide all this in our clinic.
Let's talk about IVF with donor eggs for patients from the UK. How is that process organised?
So first we have to go through the patient's history, couple history, like what was the problem, what is the situation now, do some assessments. They can do it in their own country and send it, and we can check some uterine assessments, some hormonal investigations, and then we can share with them donor profiles. They can think about it, choose the right ones, and then we can discuss what is the next step. We can just start it to prepare. First of all, they have to come and we have to check sperm parameters, if everything is okay, and if we assess infection disease with the male partner and everything okay, we can start our process, free sperm, and then find donor and do embryos. After that, the second step, they have to come back if there is frozen cycle preparement, and we have to prepare them with HRT, hormonal treatment, and after she is ready, we can proceed with embryo transfer. That's all, not so complicated as they think. We can manage it very easily.
Do they have to travel a maximum of twice to the clinic then?
Yes.
And how long do they have to stay when they're there?
First visit will be 1-2 days, because we have to freeze sperm. If this is a fresh transfer, then they have to stay. If it's frozen cycle and we have to do FET, frozen embryo transfer, they can go back as soon as the embryos will be ready and they will have time. We can start the second process, like preparement of the endometrium, uterus, and as soon, even we can manage this, like they can stay in their country, take some medications, and then straight away come for the embryo transfers. So only twice it will be normal to come.